Good day, everyone, and welcome to our presentation. Today, we'll be talking about the subcutaneous route of drug administration. So, we'll learn more about the subcutaneous administration as we go on with our presentation. Looking at the definition, so subcutaneous administration means injecting a drug into the fatty tissue layer that sits directly below the dermis, which is the skin, and above the muscle. So the key feature of this route of drug administration is that it provides a slow and sustained absorption of the drug into the bloodstream because fatty tissue has fewer blood vessels than muscles. So, highly useful for medications that need a steady release, like insulin, vaccines, and it is also so simple that patients can do them by themselves at home. So, moving on to the anatomy of the subcutaneous layer. So, to give a subcutaneous injection correctly, you must first understand the tissue layers. So, we've got the dermis and the epidermis. These are the top layers of the skin. And then you've got the subcutaneous layer or the hypodermis, the target layer. This is like the target layer. It is made of loose connective tissue and fat, adipose tissue. It provides insulation and stores energy. And then below that, you've got the deep layer. So in the deep layer, this is the muscle layer which lies safely underneath the fat. So if you look at this diagram, you can see how the injection will move. So moving on to the common injection sites. So medications are injected into the body areas with a healthy layer of fat to avoid accidentally hitting a muscle. So you've got your abdomen, except for like 2 inch circle, right, around the belly button. And then you've got your upper outer arm where the fat, like the fatty that portion of the arm, yeah, you can also inject there. And then you've got the anterior thigh, the front and outer parts of the thigh. And then you've got the upper buttocks or the glutes. This is the upper and outer fatty area. So moving on along with the procedure. So first you need to clean your hands and gather your equipment, cleanse the patient's skin using an alcohol swab, and then you gently pinch a fold of skin and fat up away from the underlying muscle. And then the angle is very important. So you insert the needle at about 45 to 90 degrees angle, but usually people use 90 if the patient has a thick fat layer or if using a very short needle. And then the delivery, like the injection, or you inject the medication slowly without withdrawback the needle and safely discard it in a sharp container. So the advantages and disadvantages. So advantage is that it is easy, convenient, and safe enough for self-administration. It causes less pain and deeper intramuscular injections and provides a long-lasting, steady drug effect. Then the disadvantage is that you can only inject a very small volume of fluid and it cannot be used in a medical emergency because absorption is too slow and it can cause local skin irritation or bruising. So these are the advantages and disadvantages. As we say, bruising. Moving on to the examples of drugs or common drugs, you've got your insulin for diabetes, your heparin and enoxaparin like for blood thinners to prevent blood clots. You've got your certain vaccines, and then the precaution for giving this medication is that you must rotate the injection site. You must not like use the same spot, every day. So this prevents a condition called lipodystrophy. Yes, lipodystrophy, where the local fat tissue hardens or wastes away, altering how the future doses are absorbed. So for our references, these are the books that we have used. Thank you all. This was also our presentation.